Did you know that some common medications, used by millions of elderly people around the world, can accelerate memory loss and even trigger dementia? What should help treat simple symptoms like insomnia, anxiety, or allergies may be silently harming your brain? Studies show that prolonged use of certain medications can increase the risk of developing dementia by up to 60%. And the most alarming part, many of these drugs are sold over the counter and are part of the daily lives of retirees who just want to live more comfortably and peacefully. If you or someone in your family takes medication for sleep, allergies, anxiety, or even urinary incontinence, it's crucial to watch this video until the end. Today, we'll reveal 9 popular medications that can directly affect your memory, cause mental confusion, and even lead to irreversible dementia. And the most dangerous part, this happens slowly, progressively, almost imperceptibly. By the end of the video, you'll also learn safer alternatives to protect your brain health and maintain your independence for many years. So, if you care about your memory, your independence, and the future of your health, stay with us. And don't forget to like this content, leave a comment, and subscribe to the channel. This helps us bring this information to more people who, like you, want to age with quality of life. Now that you understand the seriousness of this topic, let's move on to the next essential point: what dementia is and how it develops in the body. What is dementia and how does it develop? Dementia is not a specific disease. It's a set of symptoms that severely affect functions like memory, reasoning, language, and behavior. It directly interferes with a person's ability to perform daily tasks, such as eating, bathing, or remembering simple appointments. The most common form of dementia is Alzheimer's disease, but there are others, such as vascular dementia, Lewy body dementia, and frontotemporal dementia. The common factor among them is the progressive degeneration of brain cells. The process usually begins subtly: small forgetfulness, confusion with dates, or difficulty finding words. Over time, these signs intensify. A person may get lost in familiar places, repeat phrases, forget the names of close family members, and experience unexplained mood swings. What few people know is that certain medications can accelerate this process. They interfere with chemicals essential for brain function, especially acetylcholine, which is responsible for memory and learning. When these medications are used continuously, the damage can be cumulative and often irreversible. That's why identifying and avoiding these medications is crucial for anyone who wants to protect their mental health, especially in old age. In the next chapter, we'll understand why the elderly are more vulnerable to the side effects of these medications and the risks they pose. Why are the elderly more vulnerable to medication side effects? As we age, the body undergoes significant changes that alter how we metabolize medications. The liver and kidneys, responsible for processing and eliminating substances from the body, lose some of their efficiency. This means certain drugs stay in the body longer, increasing the chance of adverse effects. Additionally, many elderly people take multiple medications at the same time, a practice called polypharmacy. This combination increases the risk of dangerous interactions between compounds and can amplify side effects, including those that directly affect the brain. Another important factor is the natural reduction of cognitive reserve with age. In other words, an elderly person's brain is already more vulnerable, and any chemical interference can have a faster and more intense impact on mental functions. Medications that were once well tolerated may now cause excessive drowsiness, disorientation, memory lapses, and, in more severe cases, mental confusion and delirium. Often, these symptoms are mistaken for normal aging, delaying diagnosis and correction of the problem. Therefore, it's essential that medications used by the elderly are always carefully evaluated, especially those with sedative or anticholinergic effects, the biggest culprits when it comes to cognitive decline. Now that you understand why an elderly brain is more sensitive, it's time to learn about the specific medications that can trigger dementia. And we'll start with one of the most common, the antihistamine diphenhydramine, found in many formulas worldwide. Medication 1. Diphenhydramine, Benadryl. The first medication on our list is a well-known antihistamine, easily found in cold, flu, seasonal allergy, and even some sleep aid formulas. Its name is diphenhydramine. Although it has a reputation as a simple and effective product, its effect on the brain can be extremely harmful, especially in older people. Diphenhydramine belongs to a group of medications called first-generation antihistamines. The problem is that it has a strong anticholinergic effect, meaning it interferes with the activity of a neurotransmitter essential for memory and learning, acetylcholine. The decline in levels of this substance is directly linked to the development of dementia. That's why frequent use of medications containing diphenhydramine can cause mental confusion, disorientation, excessive daytime drowsiness, and, over time, accelerate cognitive deterioration. It's important to note that these effects don't appear immediately. The risk lies in repeated, continuous use, often without medical guidance. People who take this type of medication for long periods, thinking they're treating something simple like allergies or insomnia, may unknowingly be fueling a much more serious problem. Therefore, it's essential to check the active ingredients of any medication you use, especially if you're older. When possible, opt for modern alternatives with lower risk to the brain, and always under the supervision of a healthcare professional. In the next chapter, you'll learn about an even more dangerous group of medications for the mind, benzodiazepines. Medication 2, diazepam, lorazepam, alprazolam, Valium, Ativan, Xanax. The second class of medications on this list is widely used by people suffering from anxiety, insomnia, or muscle tension. We're talking about benzodiazepines, medications like diazepam, lorazepam, and alprazolam. These drugs act directly on the central nervous system, promoting a calming and sedative effect. Initially, they seem like a quick solution for anxiety attacks or sleepless nights. But continuous use hides serious risks, especially for the brains of older people. Studies have already shown that prolonged use of benzodiazepines is associated with a higher risk of cognitive decline and dementia. These medications can affect short-term memory, reduce concentration, trigger episodes of mental confusion, and increase the risk of falls, one of the biggest dangers to the health of the elderly. Another concerning factor is tolerance. Over time, the body needs increasingly higher doses to achieve the same effect, further increasing the risk of dependence and brain damage. And because they're frequently prescribed, many elderly people end up using these medications for months or even years, believing they're completely safe. Therefore, it's crucial to regularly review the medications being used, especially those for anxiety or insomnia. There are more modern and safer approaches to managing these issues without compromising brain health. In the next chapter, we'll discuss another silent villain, tricyclic antidepressants, which have been used for decades but can also accelerate cognitive decline. Medication 3, amitriptyline and nortriptyline. Amitriptyline and nortriptyline are common names among older antidepressants still in use. They belong to the class of tricyclic antidepressants, developed decades ago to treat depression, chronic pain, migraines, and sleep disorders. Although effective in some specific situations, these medications pose serious risks when used by older people, especially for long periods. Like diphenhydramine, tricyclic antidepressants have a strong anticholinergic effect. This means they reduce the activity of acetylcholine in the brain, the same neurotransmitter essential for functions like memory, attention, and spatial orientation. When this substance is frequently inhibited, the brain begins to show signs of failure, constant forgetfulness, difficulty concentrating, mental confusion, and, over time, symptoms typical of dementia. Additionally, these medications can cause other side effects in the elderly, such as low blood pressure upon standing, increased fall risk, dry mouth, blurred vision, and constipation, factors that further complicate quality of life at this stage. The biggest problem is that these drugs, being old, are still widely prescribed in various contexts, often in low doses to aid sleep or relieve pain. And it's precisely this false sense of safety that leads many people to use them without realizing the cumulative damage to the brain. If you or someone you know uses this type of antidepressant, it's essential to review the medication with the prescribing doctor and discuss more modern and safer alternatives, especially if there's already a history of forgetfulness, slowed thinking, or confusion. In the next chapter, we'll cover antipsychotics, strong medications often misused, which can drastically accelerate cognitive decline. Medication 4. Haloperidol and risperidone. Haloperidol and risperidone are antipsychotic medications used to treat disorders like schizophrenia, delusions, severe agitation, and, in some cases, behavioral symptoms of dementia. Despite their usefulness in specific situations, their use in the elderly must be approached with extreme caution. These drugs act on dopamine receptors in the brain, helping to control hallucinations, aggression, and uncontrolled impulses. However, this same action can impair important cognitive functions, especially in older people. Continuous use of antipsychotics in the elderly is associated with a significantly higher risk of accelerated cognitive decline, muscle stiffness, deep sedation, falls, and even increased mortality. Additionally, these medications can cause Parkinson-like symptoms, such as tremors, slowed movements, and postural instability. Unfortunately, it's common for these medications to be prescribed to control behaviors like nighttime agitation, restlessness, or aggression in dementia patients. The problem is that, instead of helping, they often worsen the condition, accelerating the loss of mental functions and further compromising quality of life. Antipsychotics should be used with extreme caution, always for short periods and under strict monitoring. In many cases, non-drug interventions, such as adjustments to the environment, routine, or emotional support, can offer better and safer results. In the next chapter, we'll discuss a medication many use for sleep, believing it's beneficial, but which, in reality, can put the brain at risk: zolpidem. Medication 5. Zolpidem. Zolpidem is one of the most commonly used medications for treating insomnia. With its rapid action, it induces sleep within minutes, making it extremely popular among people who have trouble falling or staying asleep. However, its frequent use, especially by the elderly, poses a significant risk to the brain. Zolpidem acts on the central nervous system as a sedative hypnotic, altering brain activity to induce sleep. The problem is that, in older people, this alteration can be too profound, causing side effects like mental confusion upon waking, sleepwalking, short-term memory loss, and even episodes of delirium. There are also reports of strange behaviors during zolpidem use, such as eating, driving, or leaving the house while still under the drug's influence, with no memory of it the next day. Additionally, prolonged use is linked to an increased risk of nighttime falls, fractures, and cognitive decline. Another important point: zolpidem can cause dependence. The body becomes accustomed to the medication and starts relying on it to initiate sleep, leading to a vicious cycle that's hard to break. In the elderly, whose brains are more sensitive to chemical changes, the risks are even greater. Therefore, zolpidem use should be carefully evaluated. In many cases, sleep can be improved with lifestyle changes, anxiety management, and healthy nighttime routines, without resorting to such aggressive medications. In the next chapter, we'll talk about a common medication for nausea and cramps that can also severely affect memory: scopolamine. Medication 6. Scopolamine. Scopolamine is a medication known for relieving nausea, vomiting, cramps, and abdominal discomfort, as well as being used for motion sickness. Available in tablets, drops, and even transdermal patches, it may seem harmless at first glance. But its effects on the brain require extra caution, especially in the elderly. This medication acts as a potent anticholinergic agent, meaning it blocks the action of acetylcholine, a neurotransmitter essential for memory, attention, and mental balance. When scopolamine is used frequently, even at doses considered safe, it can progressively impair cognitive ability. In older people, side effects tend to be more intense: confusion, difficulty orienting oneself, delirium, and memory lapses are common. In more severe cases, prolonged use can accelerate the development of dementia. Additionally, scopolamine can cause blurred vision, dry mouth, dizziness, and urinary retention, symptoms often mistaken for signs of aging, making it harder to identify the real problem. Because it's often used without a prescription, many people don't make the connection between its effects and mental impairment. This makes its use even more dangerous, especially when combined with other medications that also affect the central nervous system. It's crucial to reconsider the use of this type of substance, especially if there's a history of forgetfulness, confusion, or slowed thinking. Always seek alternatives with lower neurological impact, under the guidance of a qualified professional. In the next chapter, we'll discuss another common medication used to relieve cold and allergy symptoms, which also interferes with the brain in concerning ways: first-generation antihistamines. Medication 7. Chlorpheniramine and hydroxyzine. Chlorpheniramine and hydroxyzine are medications used to treat allergies, runny nose, hives, itchy skin, and even mild anxiety. Because they're present in many over-the-counter formulas, many people consider them safe. But this perception hides an important risk, especially for older people. Both belong to the class of first-generation antihistamines, substances that cross the blood-brain barrier and directly interfere with neurological function. They have a strong sedative and anticholinergic effect, the same type of action linked to an increased risk of dementia. In the elderly, continuous or frequent use of these medications can cause slowed thinking, difficulty forming new memories, mental confusion, and even hallucinations. Often, these effects are mistaken for natural signs of aging, delaying recognition of the real problem. Additionally, these drugs can cause daytime drowsiness, increasing the risk of falls and household accidents. The impact on the nervous system is cumulative. The longer they're used, the greater the potential damage to cognitive function. Even if relief from symptoms like sneezing, itching, or hives is necessary, safer alternatives exist for older adults, with less risk to brain health. In the next chapter, we'll cover a medication commonly used for muscle pain or spasms, which also poses a silent threat to memory: muscle relaxants. Medication 8. Cyclobenzaprine. Cyclobenzaprine is a muscle relaxant frequently prescribed to relieve pain caused by muscle tension, spasms, or spinal issues. Its sedative effect often helps not only with pain but also with sleep. But for the elderly, this relief may come with serious consequences for the brain. Like other medications on this list, cyclobenzaprine has significant anticholinergic effects. This means it can interfere with the brain's chemical balance, directly affecting memory, attention, and mental clarity. Prolonged use, especially in older people, is linked to increased episodes of confusion, disorientation, slowed thinking, and a higher risk of falls. Even at seemingly low doses, the cumulative impact can be severe, and often goes unnoticed. Another concerning factor is its combined use with other medications that depress the central nervous system, such as anti-anxiety drugs or sleep aids. This combination intensifies sedative effects and increases the risk of accidents, as well as accelerating cognitive impairment. Many patients use cyclobenzaprine for weeks or even months without realizing the connection between declining mental performance and the medication. That's why it's crucial to periodically review the use of such drugs, especially if there are already signs of memory lapses or behavioral changes. In the next chapter, we'll discuss a class of medications used to treat urinary incontinence, a common problem in old age that can also put the mind at risk: antimuscarinics like oxybutynin. Medication 9. Oxybutynin and toltridine. Oxybutynin and toltridine are medications used to treat a very common problem in the elderly: urinary incontinence. They work by relaxing the bladder, helping reduce urgency and frequency of urination. However, while they offer physical relief, the cognitive cost can be high. These medications belong to the antimuscarinic class, substances with strong anticholinergic effects. And, as we've seen throughout this video, interference with acetylcholine, a neurotransmitter essential for memory and learning, is one of the main pathways for dementia development. Several studies indicate that prolonged use of medications like oxybutynin is directly associated with a significant increase in the risk of cognitive decline. In the elderly, effects can appear quickly: difficulty remembering simple tasks, confusion, irritability, and loss of mental clarity. Additionally, these drugs can cause dry mouth, constipation, blurred vision, and drowsiness. Symptoms often underestimated or attributed to natural aging, but which, in reality, indicate an adverse reaction that deserves attention. In many cases, more modern alternatives with less impact on the brain exist. Therefore, it's essential to talk to the prescribing doctor and assess whether the benefits justify the risks, especially if the person already shows any signs of memory or reasoning changes. In the final chapter, we'll summarize everything covered so far, present safe and practical alternatives, and provide essential guidance for those who want to protect their brain as they age. Now that you know the 9 most dangerous medications for brain health in old age, it's time to make informed decisions. None of these drugs should be used indiscriminately. Although they may seem harmless, their cumulative effects can lead to memory loss, mental confusion, and even irreversible dementia. It's crucial to understand that aging alone makes the brain more vulnerable. Therefore, any medication affecting the nervous system must be carefully evaluated, reviewed, and, when possible, replaced. If you or someone you know uses any of the medications mentioned in this video, seek medical advice. Don't stop taking anything on your own, but ask questions. Bring this information to your next appointment. Often, more modern, effective, and cognitively safer alternatives exist. Among these alternatives are medications with lower anticholinergic effects, non-drug therapies, dietary changes, regular exercise, stress management, and improved sleep quality, all with direct positive effects on brain health. Additionally, staying socially active, engaging in mentally challenging activities, and adopting a purposeful routine are proven ways to preserve memory and well-being in old age. Information is the first step toward prevention. Share this video with friends and family. Many people still have no idea what these medications can cause, and with a simple warning, you might change someone's future. Like this content, comment with your experiences, and subscribe to the channel. Here, you'll always find serious, up-to-date information designed to protect those you love. Caring for the mind is as important as caring for the heart. And the earlier we start, the greater the chances of healthy, active, and independent aging.